Hello, hi, my name is Dr. Tugbiyele and I'm your urogyn doctor. I'm here again. And in this video, we're going to actually answer the question, what is a urinary tract infection? So a urinary tract infection, or even commonly more known as a UTI, is an infection of the urinary tract, anywhere from the urethra to the bladder to the ureters and or the kidneys. So oftentimes it starts as an ascending infection, meaning it's an infection that starts kind of in the lower urethra, and then if untreated finds its way into the bladder, the infection then can find its way up the ureters into the kidneys. Now, how does this start? Well, we have to actually kind of consider the anatomy. In women, the urethra, the urethra, the vagina, and the rectum are kind of in close proximity to each other. And oftentimes there are bacteria that are normally residing and kind of cohabitating in the opening of the vagina, the introitus, we like to say. So that area can oftentimes be colonized by bacteria that are close to the type of bacteria we find in the opening of the anus, E-coli, and there are normal bacteria that live in the vagina and cohabitate in balance there. And so there's a lot of bacteria in that area, and if at any time a woman's immune system lowers, or if she then if there's a situation where one bacteria kind of overgrows another, or the normal bacteria that keep other bacteria in check, like lactobacillus is the bacteria that keeps other bacteria in check, kind of like the soldiers of the vagina in that area. If there's less lactobacillus, if that type of bacteria is eradicated, then other pathogenic bacteria, we call it, other bacteria that can cause urinary tract infections can overwhelm and kind of predominate and take over and find their way, in the urethra, in the bladder, up through the ureters, and then into the kidneys. So oftentimes these are ascending infections. And knowing the anatomy, because these areas are more closely associated in women compared to men, women are at higher risk for urinary tract infections. What are other risk factors for urinary tract infections aside from being a woman? Women who've had urinary tract infections in the past are at greater risk of getting another one. Women who have a history of comorbidities or other medical conditions like diabetes, where there's high blood sugar, because we know that bacteria love sugar. So high blood sugar, which translates to high sugar content in urine, bacteria love that, and they can then stick to these sugar complexes and molecules and then predominate and proliferate. Patients who are immunocompromised, patients who are sexually active, because just the active intercourse at times will increase the risk of bacteria from the vagina and or from around the anus find their way in the urethra area. So that's just again anatomy and sexual activity. Menopause. During menopause, the normal bacterial balance in the vagina is altered. The vagina that typically is an acidic environment in pH then turns to a basic environment in pH because there's less lactobacillus. So it's not able to ward off abnormal bacteria from the rectum and or around the rectum and anus area. So in menopause, there's less estrogen, there's less host defense, we call it. There's less an ability for the body to block or to ward off infections. And so in a woman who's in menopause, there's a greater risk of ascending urinary tract infections. Women who have prolapse are at greater risk because they are not, for example, if there's a bladder prolapse, urine can fester in the bladder, and that can be a nidus for infections because the bacteria just love to proliferate in that area, and it's less likely that the urine will be cleared in a woman who has prolapse, so a dry bladder. Foreign body, patients who perhaps have undergone prior surgery and with a mesh or a foreign body or anything of that nature, and if there's residual foreign body in the bladder and or urethra, bacteria love to hang on to that, cause stones formation, and that can be a nidus for urinary tract infections. So those are just some of the risk factors for bladder infections. So when we talk about an evaluation, of course, after getting a thorough history and a thorough physical exam, we determine, okay, are there stones? Is there prolapse? Is a woman in menopause because her tissues are atrophic and lack and hypoestrogenic? What else? We also want to know how, with history, if she's drinking enough water, if she's emptying her bladder, normal bladder habits, normal hygiene practices, wiping front to back. Every woman knows that. So it's important. And there's some women who have a history of fecal incontinence, and I'll actually talk about fecal incontinence in a different video. But if there's if there's stool in the vaginal area or in the rectal area because a woman has accidental stool leakage and a problem with controlling bowels, then that could be another source of E. coli and other bacteria that can cause urinary tract infections. So after a thorough evaluation, then we talk about, okay, what are some of the solutions? Well, we always start with lifestyle changes, so drinking enough water, wiping front to back, hygiene practices, emptying your bladder before and definitely after intercourse, so that there's less of a likelihood of bacteria proliferating and congregating in the bladder. Let's see here. Some women, we recommend cranberry supplements, not cranberry juice, because the juice actually has a lot of sugar, but more so concentrated cranberry products like the capsules or tablets have a higher content of cranberry in there that then makes it harder for bacteria to stick to the bladder wall, to the urethral wall, and so then with adequate water intake, then that bacteria gets cleared out of the body. So cranberry supplements can make it harder for infections to proliferate. Let's see here, prophylactic. Let's see, I'm looking at my notes. Pyridium. Pyridium is it's a over-the-counter supplements or medicine, so to speak, that takes away the burning and stinging that can sometimes be associated with the bladder infection. It's not going to treat a true infection, but it's actually going to at least make it more comfortable for women while she's getting treatment. So those are some of the natural solutions. Some women may need to take antibiotics, and if they've tried natural solutions and that hasn't helped, then there are antibiotics that women can take to help to clear the bacteria. And we typically would start with a 3 to 5 day treatment course of an antibiotic. It doesn't mean that if a woman has an urinary tract infection, she needs to be on 7 day, 10 day, 14 days right off the bat. We always go with the shortest duration possible. And if a woman seems to get infections after intercourse, there's actually a term called post-coital prophylaxis or post-coital treatment. So if a woman she finds that her trigger, her risk factor for UTIs is sexual intercourse, then we tell women to take an antibiotic after intercourse to help to prevent infections, and that helps them prevent the need to be on a week's worth of antibiotics every single time or every other time. And then there are times where surgery is necessary, especially if there's a prolapse, where the bladder needs to be lifted up, or there's a foreign body or stone that needs to be removed. So those are maybe times where surgery is needed. So I know I talked a lot, and of course the recommendation always that a woman doesn't have to live or put up with these things. These are common conditions that affect many women, and as a board-certified urogynecologist, we see urinary tract infections all the time in women, and there are ways to get this treated. There are safe and effective options that work that I recommend for my patients to definitely come in and see a urogynecologist like myself to get to the bottom of it and get to a solution. So if you would like more information about urinary tract infections and about how to find me and reach me, you can reach me at my website, drdrstephentugbiyele.com. That's Stephen with a PH, Tugbiyele.com. You can also visit my YouTube channel, Dr. Stephen Tugbiyele, and I'm also on LinkedIn. My practice website is Northside Center for Urogyne. That's Northside, one word, Center for Urogyne. And the office number is 470-325-1280. That's 470-325-1280. So there's many ways to reach me. Please do subscribe to this channel. Do share it, please, and please press that like button if you'd like if you'd like to be notified when I make more videos. And if this video added value to your life, please do share. Thank you so much. There are other women who are suffering that can also benefit, so please do share this video. And till the next video, thank you. Take care. Be well.